Well, another appeal for medical tourists to China is, of course, traditional medicine therapies. An estimated 300,000 foreign visitors travel to China annually for TCM-related treatment and wellness programs. And TCM can be used as a supportive treatment during cancer care to help reduce side effects from chemotherapy and help with pain relief. This model is widely used in China, and there's a growing interest in integrated oncology in the West. Nina Fuller-Shavel is a leading integrative medicine doctor in the UK.
Integrative oncology is really about having the best of the best and marrying both worlds. So it's about combining the best of standard of care, which includes surgery, radiotherapy, chemotherapy, immunotherapy, cell therapies, the whole gamut of conventional cancer treatment with additional support. And that might include nutritional and lifestyle modifications, natural products, mind-body support, and complementary therapies.
What aspects of traditional Chinese medicine can help with symptoms and side effects of cancer treatment, and how do they work?
And we know the Society for Integrative Oncology, or SIO, has created guidelines that cover things like pain management, anxiety and depression, and fatigue support. And when we're looking at these particular guidelines, we know, for example, for pain, there's a strong recommendation for acupuncture in relieving pain that breast cancer patients might experience while on hormone therapy. And we should also be offering that for patients who might be experiencing more general cancer pain and musculoskeletal pain. In terms of how things work, I mean, acupuncture has a myriad of ways of working. We know there's some local effects that happen at the needle in terms of natural painkiller relief. But we also know that it acts on the brain, and it actually communicates with the brain, influences the pathways that can dampen the feelings of pain peripherally in the body.
What lessons can Western medicine take from traditional medicine?
I think it's a bi-directional bit of learning, really, that we have to do. I think traditional medicine has one of its strongest suits as recognizing the whole human being. And actually, we know that Lancet Oncology Commission has really called it a human crisis in cancer care. We are very good at treating tumors. We're not very good at treating people. And I think that whole person approach, looking at the person and looking at prevention all the way to on treatment support through to survivorship care, is something that traditional medicine does very, very well. But I also think it's the bidirectional relationship goes the other way. And I think it's really important that traditional medicine is also held up to rigorous science, so we really understand what works for us in our modern day right now. So I think the two together, working in synergy, is the most powerful approach.
How do you see integrated healthcare evolving over the next decade, for example?
Wow, what a wonderful question. So I would say the first thing that we really need to do is really follow the path that WHO strategy sets out for us. We need to make sure that we are looking at how we regulate traditional medicine well, how we standardize our approaches to make sure that the highest standard of care are being delivered. We need research, we need funding for that research. In fact, less than 1% of global healthcare research funding goes into traditional complementary and integrative medicine, and that really needs to change. And I love to see China's investment in this. We also need to be thinking about how do we practically integrate this within biomedicine. It's about working really closely together, and that's about implementation research and supporting that across the world so that people can have access to this sort of care. So we really need to follow, I think, the WHO traditional medicine strategy and the research strategy to really see this evolve and become a part of just good medicine. For me, integrative oncology isn't actually something that I want to be integrative oncology in 10 years' time. I want it to be oncology. It needs to be just simply good medicine.